Dr. Google is dead. Now it's Dr. AI. Chatbot doctors are quickly becoming Australia's go-to tools for managing health, apparently.
Yes, and it's not just patients. Almost half of Australian clinics are using AI in appointments to keep notes and track our details. In some cases, the AI scribes can get things badly wrong. So, is it really safe to hand our health over to the bots?
Well, for more, we're joined by futurist McQueen. Michael,
good morning
to you. Okay, we know patients are using AI.
Yeah.
We know doctors are also using AI. Two sides coming together in a clinic.
Yes.
What do we need to be concerned about here?
Well, I think the concern is confident wrongness in AI. You know, the level of certainty with which it gives answers and information. Because we've used Dr. Google for years, but it just gave you info. This actually gives advice. And so that's really the challenging thing. You've got doctors that are using it can hallucinate, patients that are using it, and often, you know, they'll actually push back against the doctor. The doctor will give a professional clinical view and they go, but AI said this. So who do we now trust is probably one of the key issues.
Is there a safe boundary there, like a safe level to which doctors could be using AI?
Yeah, so definitely they are using. I think the challenge we're seeing for doctors, and the word I'm hearing increasingly is de-skilling, and we're all so at risk of this idea of you rely on AI, you lose your edge, you lose some of those cognitive skills we've developed for years because we get a bit cognitively lazy. So there is a risk of that, but from a patient side, there are benefits. You know, the risks are there, but the benefits. I was chatting with someone this week. His wife had been sick for ages. They'd gone to multiple doctors. They couldn't figure out what it was. She got so fed up, she put the details into ChatGPT. It instantly figured out what a thing was. She went back to a doctor and said, oh, that wasn't even on our radar as one of the things. So like those blind spots that as humans we can have, the AI connected all these dots that all the experts had missed.
That's when it works right.
Yes.
Because they didn't go and treat the thing that came up, you know, just because it came up on AI. They went back to the expert and said, what do you think about this? They said, oh, let's investigate.
Yes, yeah.
So that's obviously how we can use it to our advantage.
Yeah, definitely. I think the thing we can learn from it, and this is interesting, we think about what are the human skills that AI can't do, and there are many of those. One of the things that AI actually does well is listen, which is interesting because there was a study done of a whole bunch of doctors a little while ago. They found the average doctor, when a patient's sharing their symptoms, what they've come in for, interrupts after just 23 seconds on average. Really? And they found if they waited 6 more seconds and listened a little bit longer, they'd actually get to the key detail the patient was going to share that would sort of make it clear as to what the issue was. So how quickly doctors, I know, like, jumped in too fast, and AI, it does listen, like it just listens incessantly, even when we rabbit on back and forth, and it just doesn't lose patience with us, and there's probably some benefit to us learning a bit from that.
It feels like we're just at that beginning stage of it right now, but for med students who are going through that process, they are going to rely on it more and more and more. Are we going to see more of this, or is AI just going to get better, do you think?
So AI is getting better, but the thing is we've got to train the med students to be able to work with it. And so University of Sydney was one of the early movers in this, so they had a key assessment. They were the first I saw to do this, where you actually had to take a ChatGPT diagnosis and critically analyse it. So rather than saying, let's never use ChatGPT in education, this is a couple of years ago now, said, it's happening, how do we work with it? And I think that's going to be the key thing.
Do you see a point where AI gets so good that it can replace a doctor?
Well, to an extent, we're seeing elements of that. There's a company in the US called Doctronic, and so they're doing automated, basically replenishing or renewing of prescriptions. But I also think what doctors really do well that's hard to replace is care. Maybe they could listen better, but that sense of showing empathy, using judgment, is not going to go anywhere anytime soon. But there is a need to upskill. We've got a lot of doctors and specialists still sending faxes, for instance. So, like, there's a need to constantly upskill, but I think that very human role will never disappear.
I think we need to look at why that's happening, because I know in a lot of cases, particularly for GPs, they are so under the pump, particularly with the administrative burden, to free up some time so that they can upskill and use it.
Yeah, that's exactly it.
All right.
Michael, thank you.
Michael.
Pleasure.